So how did you stumble upon it in the beginning? How did you discover?
When I was a graduate student, the first T-scan was built, and it was a standalone computer that had a handle and a sensor that you bid on, different design, but it was able to read time in the bite, 3 seconds of time. Now you can record for 12 minutes if you wanted to, but it was capable of recording 3 seconds. And in that 3 seconds, it was broken up into 1/100th of a second increments. So you had, 0.01 second data resolution. And for the first time, a dentist could see timing between the teeth, what they were really doing in terms of how much rubbing, durations of rubbing, as well as forces of rubbing, but really the duration. And it was never something that was quantifiable. Dentists believed they could see time by looking at the teeth and watching them all kind of hit. And of course, this was looking at it in 100ths of a second increments. And you could actually determine that someone who had a problem like you had too much time of their teeth rubbing together and gnashing together in the chewing motion. And when that was shortened by, like in your case, reshaping the teeth, the timing went way down and the symptoms went away very fast. We went away like you noticed an improvement in right after your first session.
Yeah, immediately.
Right, well that's what was taking place, using timing as a guide. And the timing parameter was discovered in 1987. And it's the basis for this treatment, exclusion time it's called, and the treatment is called exclusion time reduction. And that's a specific treatment aimed at this timing element that was discovered with the first T-scan. It's the core problem in the neurophysiology of this issue that you experience and many patients experience, and it has to do with the duration of time that the back teeth compress each other. If that is too long, the muscles of mastication fire too much, they frequently fire, and that creates lactic acid and tension. And as a result, when you shorten it, that all disappears through special neurophysiology of the molar tooth socket. So that was all discovered in the late 1980s, and since then, the treatment has been published about many, many times, and you're fortunate you got to go through it.
Yeah, definitely very fortunate. Thankful.
Any other questions?
No, nothing. Thank you.
Thank you for your time and your interview.